Hello, I'm Jeff Cummings, Director of the Cleveland Clinic Ruvo Center for Brain Health. At the Center for Brain Health, we take care of patients with Alzheimer's disease, Parkinson's disease, and multiple sclerosis. We conduct research and perform clinical trials to try to find new treatments for patients with these brain diseases. A critical aspect of our care is to work with caregivers. This series of videos introduces you to aspects of caregiving, including how to take care of yourself.
At this time, there is no cure for Alzheimer's disease. Current treatments help to maintain the brain's ability to function, reduce behavioral problems, and slow the worsening of symptoms of the disease.
There are several medications that are approved to treat Alzheimer's disease. Some are effective throughout the disease process, and others are used to treat moderate to severe dementia. These drugs work by regulating the chemicals that transmit messages between the brain's nerve cells.
Medications may help with thinking, memory, and language skills, and can lessen certain behavioral problems. On the other hand, they do not stop the progression of the actual disease. So even individuals who take these medications will eventually experience decline in their function.
For all stages of Alzheimer's, we prescribe drugs known as cholinesterase inhibitors. There are 3 cholinesterase inhibitors on the market: donepezil, galantamine, and rivastigmine. These drugs slow the rate at which symptoms become worse and can help control some behavioral problems. We're still learning what the connection is between these inhibitors and the brain. They prevent the breakdown of the brain chemical acetylcholine, which affects memory and thinking. As Alzheimer's progresses, the brain produces less acetylcholine. So these medications may not seem as potent in advanced stages. But although the disease continues to progress, despite usage of these medications, they still can provide a symptomatic benefit until late in the disease.
There is no evidence that one cholinesterase inhibitor is more effective than another. However, they may differ in side effects for any one individual. The most common side effects involve nausea, loss of appetite, or diarrhea. Generally, these medications can be taken with other drugs without producing any adverse interactions.
For moderate and severe cases of Alzheimer's, memantine has been shown to reduce some symptoms. Doctors believe memantine helps regulate glutamate, an important brain chemical. Normal levels of glutamate are important in learning new information and other brain activities. Often, memantine and cholinesterase inhibitors are prescribed in combination. On average, patients with moderate to severe Alzheimer's disease who take both types of medicine do better than those who take no medicine or either one alone. However, each patient is different, and treatment response and side effects should be carefully monitored.
Recent studies show that high doses of vitamin E may help some individuals with Alzheimer's. Vitamin E appears to slow the decline in people with moderate Alzheimer's for an average of about 6 months. This can temporarily allow patients to continue to perform daily activities, such as dressing or feeding themselves, even though it is available over the counter. Too much vitamin E also has the potential for side effects, so a doctor should still monitor treatment.
Clinical trials are looking at other possible interventions. Many of the new agents under study are intended to interfere with the buildup of a protein called beta amyloid that accumulates in the brain very early in the course of Alzheimer's disease. If successful, these type of drugs may slow the progression of Alzheimer's. Other approaches include physical exercise, antioxidants, and the effects of cardiovascular and diabetes treatments. Unfortunately, bringing a new drug to the market can take up to 7 years.
It is not uncommon for those with Alzheimer's disease to also have vascular changes or strokes in their brains, which can accelerate cognitive decline. Therefore, it's important to control those conditions that increase the chance of stroke, like high blood pressure, diabetes, and smoking.
An important part of treating Alzheimer's involves more than just medication. It is known that certain lifestyle factors can not only affect your risk of developing Alzheimer's, but also may play a role once somebody develops symptoms. Poorly controlled high blood pressure or diabetes, smoking, or a sedentary lifestyle, even in midlife, can increase the risk of developing Alzheimer's. On the other hand, regular exercise, both physical and mental, may reduce one's risk of the disease and even have a beneficial effect in those who already are showing signs of Alzheimer's. Diets that are rich in antioxidant foods, such as green leafy vegetables, berries, and dried fruit, also may be helpful. Individuals who are engaged in social activities and lifelong learning also do better.
Perhaps what may turn out to be the most effective are combined interventions. with strategies that focus on helping people maintain mental function, to managing behavioral symptoms, to slowing or delaying the symptoms of the disease.